Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today, I'm talking to Iris Lafeber about 3D printing of tablets for paediatric patients. Please, could you start by introducing yourself?
I'm Iris Lafeber. I'm a pharmacist by background, and currently I am doing my PhD research at the Leiden University Medical Center in Leiden, the Netherlands, on 3D printing of personalized pharmaceuticals. And it's a very broad research topic. So I've been involved in this topic for now about 5 years, I think. Yeah.
And could you give us a brief overview of your role, what your current position involves?
So, of course, as a PhD, you do a lot of research, so that's the main part of my job. It's very broad, so it's on 3D printing of pharmaceuticals, and I do research on the drug product development, on the technical development of the printer, but also societal impact research, and of course clinical research, which is the topic of today. Then I also do educational, work in this topic. So that's a lot of fun.
Now, you gave a presentation at the JERPAC Congress this year entitled Determination of the Bioequivalence of 3D Printed Tablets for Pediatric Use. And I want to ask you more about this project. But first, could you tell us in simple terms, what is 3D printing and how can it be applied to medicines?
So 3D printing is building a prototype basically from from a computer model. So it has been used since the 80s, I think, so already a long time, and it was used in a wide range of fields to easily and quickly make prototypes. So it's a manufacturing technique which makes one of a kind, really, of a product. And that's also something that we would want in the pharmaceutical healthcare, because no patients are all the same. So while the pharmaceutical industry is really specialized in making good quality medicines based on a one-size-fits-all principle, not all patients benefit equally from that medication. So they might benefit more from a personalized product, which is what the 3D printer is perfect for to produce.
And why is 3D printing particularly suitable for pediatric doses?
Pediatric patients, they especially need different doses than is being produced by the pharmaceutical industry. So, for instance, the pharmaceutical industry, they typically make tablets, which can be too large for the pediatric patients to swallow. They can have the wrong dose. At this point, pharmacists struggle to get the right medication to the pediatric population. So they compound a lot of medication at the moment. But that's also very laborious and time intensive. So that's why 3D printing could be especially suitable for pediatric doses, because it can produce the correct dose for pediatric patients without the extra labor that is needed when compounding, for instance, an oral solution.